So we're very fortunate here at the University of Florida that collaboration is in the DNA across the entire university. And the reason why that is so important to sports neurotrauma is that the field has really evolved and grown to truly be an interdisciplinary field. And so we have close partnerships with sports medicine, with the team doctors for the University of Florida sports programs, for the high school sports medicine programs that we are involved with neuropsychology, with psychiatry. And so the fellow who comes here gets to see every aspect of neurotrauma, and we can sort of tailor the weighting of that based on the needs and interests of the individual.
I am a team physician, and the fellows work with me and our other team physicians as part of their training, specifically with football. Our access to the athletes and to practice allows the fellows to see concussions when they happen and see in the immediate aftermath of the injury, which is different than some of the clinic settings when they've had the injury for several days to weeks. We've been able to try some new technologies for prevention of injuries. Some of those are for concussion. We have multiple styles with helmets. We have a head impact telemetry system. So I think there's a lot to be learned from new technologies that are coming out, and we usually are toward the front of finding out these things and trying to employ them with our athletes.
Because of the academic nature of what's here, our fellows have wonderful opportunities to get research experiences in this ever-evolving and emerging field. Amongst the many resources that we have here is the Brain Rehabilitation and Research Center based at the VA. We have our centers of research here at the University of Florida, kind of our brain injury center, as well as our TRACS program, our trauma, concussion, and sports neuromedicine program. And the research that has come out of the group here has actually been quite impactful, having been cited multiple times at national conferences such as the American Academy of Neurology Sports Concussion Conferences, as well as our fellows having won national research awards in other venues for the work that was done with our population here during their fellowship training.
We also have faculty that are doing more of the non-operative sports medicine concussion work. And so with that comes the opportunity for the fellows to also gain expertise in some of the non-operative procedures that are oftentimes needed for these patients with concussion. And so those include things like trigger point injections, occipital nerve blocks, chemodenervation with botulinum toxin, joint injections, and some of the non-operative kind of musculoskeletal interventions. With the training in the Sports Neurotrauma Fellowship, there is eligibility to become subspecialty board certified in brain injury medicine through the American Board of Physical Medicine and Rehab. And that's an opportunity for both fellows that come in that are neurology trained, but also fellows that are PM&R trained.
Another opportunity that is unique is the ability to kind of get that sideline sports acute management opportunity at a major sporting level program like we have here at the University of Florida. So it's unique that you have a university that is both top 10 in academics and top 10 in athletics combined into one place. It really is a unique opportunity for the fellows who train here.